Diabetes is a chronic disease that keeps the body from turning food into energy. Early in type 2 diabetes, cells in the body do not respond well to insulin. This is known as insulin resistance. Insulin is produced by the pancreas and is needed to take glucose from the bloodstream into the cells, where it is used as fuel. If cells cannot respond to insulin, or if insulin is not produced, the body cannot use the energy from food. At first, the pancreas responds by making more insulin, but eventually it cannot produce enough insulin to overcome insulin resistance. As less glucose enters the cells, the glucose rises to harmful levels in the bloodstream, causing hyperglycemia or high blood glucose. In prediabetes, blood glucose levels are higher than normal, but not high enough to be diagnosed as diabetes. Over time, hyperglycemia can damage blood vessels, organs, and nerves. This leads to serious health conditions including eye problems, kidney disease, nerve damage, sexual dysfunction, tooth and gum problems, and heart and blood vessel disease. People with uncontrolled blood glucose have a high risk of having a heart attack or stroke. Signs and symptoms of type 2 diabetes. Common symptoms of type 2 diabetes are feeling tired, cranky, thirsty, or hungrier than usual, having to urinate more than usual, and unexplained weight loss. Other signs may include slow healing of infections or bruises, more infections, and numbness or tingling in the hands or feet. Many people do not know they have diabetes or prediabetes because they may not have any symptoms until complications appear. If you are at risk of diabetes, ask your healthcare provider if you need to be screened. Risk factors. People of all backgrounds can develop type 2 diabetes. However, it affects non-white people most often. Diabetes runs in families and is more common in people who are overweight, over 40 years old, and not active enough. Women who have developed gestational diabetes or diabetes during pregnancy are at an increased risk for developing type 2 diabetes later in life. Diagnosis. To diagnose type 2 diabetes, your healthcare provider will take blood samples to measure how much glucose is in the bloodstream. Glucose tests may be repeated to confirm the diagnosis. If you are diagnosed with type 2 diabetes, your healthcare provider may also check hemoglobin A1C blood levels periodically. This test measures your average blood glucose level over several months. If your hemoglobin A1C level is too high, your treatment plan is likely to change. Treatment. Type 2 diabetes cannot be cured, but you can learn how to manage your diabetes with help from your healthcare team. The goal is to keep your blood glucose in a healthy range. To do this, you will learn to balance nutritious food, physical activity, and diabetes medication. You will also learn to monitor your blood glucose and keep your blood glucose levels steady. Nutrition. Good nutrition can help you control your blood glucose and prevent future problems. A registered dietitian can help you create a nutritious meal plan. Eating several small meals spaced evenly throughout the day may help you stay in your target range. Do not skip breakfast or wait until late in the day to eat most of your food. Increasing activity. Physical activity controls weight, strengthens the body, helps manage blood glucose, and helps lower your risk for heart disease. Always check with your healthcare provider before starting an exercise program. Ask your healthcare team when to check your blood glucose and which blood glucose ranges may make exercise unsafe. If you are overweight, a loss of even 5 to 10 pounds can help control your blood glucose. Losing weight may increase your energy level and lift your mood. Talk with your healthcare team about setting a healthy weight loss goal. Taking medication. Your healthcare provider may prescribe medication to help you reach your blood glucose goals. Different diabetes medications act on different parts of the body. You may need to take more than one type of medication. Some diabetes medicines, including insulin, cannot be swallowed. Insulin can be given through a needle and syringe, an insulin pen, or an insulin pump. Taking medications every day, especially in shots, may seem overwhelming, but these are powerful tools you can use to stay in control of your health. Monitoring blood glucose. Your healthcare team will show you how to check your blood glucose levels. They will also help you set your blood glucose target range to reduce your risk of health problems.